So let's just discuss some of the muscles that actually are important on this. So the back of the skull here is a process, and there's a muscle that runs from there to this clavicle bone, sternal bone here, and on turning the head we can actually see how that runs down there like that, and we can apply pressure on that. Probably there is a little bit of a spot, and we can just direct the patient or yourself to just nice deep breaths. And then we can reciprocate on the other side, obviously. And you can see this line as it runs there. And just release. There's also scalenes that are here. They're quite tender sometimes. And those are breathing muscles.
Do they help to lift the first rib up in a breath?
Absolutely. Very important muscle, very unknown muscle, but very, very important muscle. And they can go quite tender, hey? Okay, and then from there we can do the suboccipital, and it's easier to kind of tilt the head back a little bit, and then you can feel that little space where that muscle is, and just a bit of pressure and breathing. Now you can do that to yourself in a laying position, or you can put a ball underneath and release it that way, or you can just ask somebody else to do it for you like that, and then obviously the other side as well. Kind of always trying working in balance. But a lot of people will actually find that one side is worse than the other, for some other reason. Walking, the gait maybe be incorrect. Okay, and then there's also, we can do a bit of a release on this, the medial head of the biceps. And the reason for this is a lot of people, when they have wrong posture, they actually tilt the shoulders forward until they rotate it. And as we say, these things are kind of connected to this whole complex here, because all these muscles on this fascia is actually connected. We can do a bit of the trapezius, but my view about them is they kind of always tight, because I think they're very large, important muscle, and this is more masseuse kind of thing, and I don't know if that has too much of an effect on the craniofacial pain. But from there we can definitely go to the masseter. Now the masseter, there's a bone here called the zygomatic arch, and then below of the jaw here on the corner, that masseter runs literally like that, and we can feel it where it is a bit tight. You can feel this little ball, and you can actually see how it jumps like that a little bit there. And if you can just find that and just get a little bit of pressure on there, and just breathing through it, nice deep nasal breathing, all the way down to the diaphragm. And we need to exhale for about 3 times as long as we inhale. And that takes a bit of time to release. The masseter is a very important chewing muscle. But then also the other important chewing muscle, so underneath this arch here, a piece of the mandible goes up, and there's this whole fan of muscle here called the temporalis muscle. And it's got 3 heads. It's got a front, middle, and a back head. And they can get quite tender. And I'd say that most tension headaches are related to this muscle, kind of clenching. People hold a lot of strain in these muscles here, and they can get quite tender. Now, a really thin muscle is literally like a fan, like that, if you can think of it like that. And so you need more pressure on the masseter than you do on the temporalis. So on the temporalis, it's probably more of a palpating than a pressure thing, but still a little bit firm. How's that for you? Firm enough?
The best morning I've had in a while. Thank you.
Okay. Then from there, the other thing, muscles that are important are the inside muscles. Now these are very, very difficult to get to from the outside. There's one that we can get to from the outside, and it's the medial pterygoid. Now the medial pterygoid comes from the inside of this corner, and it goes to the and we probably can show on the skull to the sphenoid process. So it goes from the inside here to this bone here, actually there. And to release part of it, we can get on the inside and just try and get a little bit in there and find that muscle pushing out. It's almost like a pinching motion onto the jaw. Do you feel that?
Mm-hmm.
That's not probably the best part of your morning, because that
it is.
Normally is quite tender there. And then we can do the same on the other side. Now I find a lot of these are actually unilateral, or one side's worse than the other in craniofacial pain, because normally there's some kind of a dysfunction to one side or the other. So those are the ones that we can reach from outside. Now there's one that you can reach from the inside. So first I want to just show the positioning of this. So when we go inside the mouth, we're going to get this kind of position. So what I'm looking for is getting in here from the inside and finding not this part of the bone, but that part of the bone. Now, as you can see, it's kind of difficult to get in there. So it's a little bit better in closing a little bit, because you can literally get your finger in there a little bit and put pressure. So this muscle here runs from there to there, and that has an influence on the jaw moving from side to side together with this muscle here. So this muscle works together with that one to move that way, and this muscle works together with this one to move this way. So the way we're gonna do it is I use obviously my hands, but what I normally advise people is to get a pencil with a rubber on the end of it, because it's kind of the right size, because I use my pinky, because that's what needs to go in there. So what we do is we just find this spot here and get you to close a little bit. And you see what I'm doing is curling around that end there, and I'm just getting, now this is normally quite the spot. And breathe. And you can literally find that just releasing tension as you go. Put pressure on there. There we go, that's releasing. And that takes not too long, maybe 30 seconds, and I can actually feel that releasing. Did you feel that release?
Oh, that went all the way into my calves.
Yes. And just another explanation of how these things are interconnected. And then obviously we have to go to the other side as well. So I go along the top jaw, and I go curling in and find that little spot there. Sorry. And then while we're in there, the other way of dealing with the masseter is to actually just have a little bit of pinching motion and find this bone, zygomatic arch that goes there, and just get in there, and you can just do little pinches in between and massage that muscle. And there's a spot right there. And just put some pressure like that in onto that muscle. So
that is so cool.